This is Shoulder Dystocia by Michelle Padilla. What is shoulder dystocia? Shoulder dystocia occurs when, after delivery of the fetal head, the baby's anterior shoulder gets stuck behind the mother's pubic bone, or occasionally the baby's posterior shoulder impinges on the mother's sacrum. If this happens, the remainder of the baby does not follow the head easily out of the vagina as it usually does during vaginal deliveries. At an otherwise normal delivery, just after the baby's head has emerged, the neck suddenly retracts back against the mother's perineum, causing the baby's cheeks to puff out. The experienced obstetrician knows at this point that the baby's anterior shoulder is caught on the mother's pubic bone, and that if he or she is unable to free up the shoulder within a few minutes, the baby will suffer irreversible brain damage or death. As the accompanying diagram shows, the maternal pelvis is composed of a series of bones forming a circle protecting the pelvic organs. The frontmost bone is the symphysis pubis. It is on the structure that a baby's anterior shoulder gets caught during a delivery complicated by shoulder dystocia. The bone at the back of the maternal pelvis is the sacrum. Because of its shape, it generally serves as a side over which a baby's posterior shoulder can descend freely during labor and delivery. However, sometimes a baby's posterior shoulder can get caught on its slight projection into the pelvis. The side walls of the maternal pelvis, although very important in determining how smoothly the process of labor will go, usually do not contribute to shoulder dystocia. Complications. The most common serious complication following a shoulder dystocia delivery is brachial plexus injury. This is when the nerves in a baby's neck, the brachial plexus, are temporarily or permanently damaged. The nerves of the brachial plexus control the function of the arm and hand. Injury to the upper part of the brachial plexus is called Erb palsy, while injury to the lower nerves of the plexus is called Klemke palsy. Both can cause significant lifelong disability. Maternal injuries. The mother, too, is at some risk when a shoulder dystocia occurs. The most common complications she may suffer are excessive blood loss and vaginal and vulvar lacerations. Statistics. Shoulder dystocia occurs in approximately 0.5% to 1.5% of all deliveries. Given that there are roughly 3 million babies born vaginally each year in the United States, this delivery complication will be experienced by roughly 15,000 to 45,000 women in a year. The larger the baby, the more likely it is to occur. However, even with very large babies, shoulder dystocia occurs only occasionally and sporadically. Therefore, a physician never knows when it will be encountered. Some risk factors include a previous shoulder dystocia. Having had a shoulder dystocia in a previous delivery proves to be the most accurate predictor of recurrence of a shoulder dystocia. This makes perfect sense. The pelvic anatomy of a woman does not change in between pregnancies. Moreover, second and subsequent babies are likely to be larger than the first or previous babies. 2. Maternal obesity. A mother's weight likewise proves to be significantly correlated with shoulder dystocia. 3. Maternal age. 4. Abnormal pelvis. 5. Other combinations of complications. Treatment and care. How is shoulder dystocia treated? Doctors use a mnemonic helper as a guide for treating shoulder dystocia. H stands for help. Your doctor should ask for extra help, such as assistance from nurses or other doctors. E stands for evaluate for epistomy. An epistomy is an incision or cut in the perineum between the anus and the opening of the vagina. This doesn't usually solve the entire concern for shoulder dystocia because your baby still has to fit through your pelvis. L stands for legs. Your doctor may ask you to pull your legs toward your stomach. This is also known as the McRoberts maneuver. It helps to flatten and rotate your pelvis, which may help your baby pass through more easily. P stands for suprapubic pressure. Your doctor will place a pressure on a certain area of your pelvis to encourage your baby's shoulder to rotate. E stands for enter maneuvers. This means helping to rotate your baby's shoulders to where they can pass through more easily. Another term for this is internal rotation. R stands for remove the posterior arm from the birth canal. If your doctor can free up one of the baby's arms from the birth canal, this makes it easier for your baby's shoulders to pass through the birth canal. R stands for roll the patient. This means asking you to get on your hands and knees. This movement can help you and your baby to pass more easily through the birth canal. These don't have to be performed in the order listed to be effective, although there are other maneuvers a doctor can perform for either mom or baby to help the baby deliver. Techniques will likely depend on you and your baby's position and your doctor's experience.